Thank you for joining us today. A significant aspect of the humaculture philosophy is feed the soil, not the plant. The most successfully sustained organizations are those focused, whether intentionally or not, on creating great places for people to thrive. Those focused on people, paying the most competitive wages or attempting to compete by having the richest benefits, usually encounter extremely difficult stretches when they suddenly believe they must refocus their attention on the bottom line. In fact, it's easy for organizations to be reactive and become distracted by all sorts of things that seem to be the most important at any given moment. Today's presentation helps organizations identify ways to stay focused in spite of or because of things that might otherwise be distractions or fetters on the path of success. We'll consider hidden opportunities in the No Surprises Act, how to minimize employer and employee costs, as well as compliance complexity. We believe the best response to the No Surprises Act is through an approach that combines strategy and compliance. A combined approach will ensure you minimize the compliance challenges, as well as create a competitive advantage for your desired talent and financially for the organization. This approach will also help improve the perceived and actual value of your organization's health coverage, contributing to the fertile soil you seek to create. This is the first of a series of 5 30-minute sessions. We'll present a lot of information in a short period of time, so questions and answers will be limited. We encourage you to post your questions in the chat. After today's session, we'll provide a written answer to every question to all attendees, as well as a replay to those who attended today. The subsequent written question and answer responses will include links to studies and data we reference here. I'd like to start by introducing our speakers for today. I'm Steve Cyboran. I'm an actuary. And actually all three of us have over 3 decades of experience in the HR benefits total reward space. I'm a consulting actuary, and I've done a lot of research around healthy enterprise, behavioral economics, an actuarial model for wellness, and I take a behavioral approach to all reward programs for employees. Wes Rogers, he's our president and our Humaculturist. He is the one that really understands all of the humaculture aspects of the rewards and applies the research that I've done in the past to the organization and the metaphor with horticulture. He is also our chief guidance officer. Jack Towarnicky is our strategy and compliance consultant. He's a lawyer, and he has decades of experience at 4 Fortune 500 companies, and is a pioneer of several benefit innovations, and is frequently presented in front of Congress and their committees around various HR and benefit issues. In fact, one of his pioneers that he's done is ERISifying all of his time off programs to avoid state wage and hour rules, and successfully won challenges in several states. Before we get going, I'd like to start with a poll to get a sense of where people are. Are you able to see the poll?
Yes.
Yes.
Okay. Looks like the responses have come to conclusion, so I'm going to close the poll. Are you able to see the results? It looks like we have 29% that haven't taken any action, so almost a third haven't taken any action. 14% are relying on their advisor to keep them in compliance. 57% believe they have focused on a good faith effort to comply, and none of our participants have developed a strategy to create a competitive advantage. What I'd like to do is now pass this over to Wes, who will tell us a little more about humaculture and how it is important to today's topic.
Thanks, Steve. I'd be glad to. So humaculture is a dynamic paradigm that we developed to understand, form, and optimize organizations and provide a holistic framework in which to make all decisions. Horticulture provides a really keen metaphor to understand organizations and give us insights into them, their purpose, and how to sustain and support the people who interact with them. A good horticulturist, in designing any garden or landscape, understands that to make that garden or landscape sustainable and successful, there are 7 real dimensions that the horticulturist has to consider: the climate and terrain, the structure of the soil, the available space and tilth of the soil, the arrangement and variety of the various plantings, the specific plants and varieties themselves, the conditions that optimize and make available, optimize the absorption of and make available the nutrients that the plants need, and then the desired harvest or the value that is to be derived from the garden or the landscape. Each of these dimensions dynamically influence one or more of the others. Similarly, we look at horticulture from this or through this lens, and it really becomes then the art and philosophy of creating profitable, healthy organizations we conceptualize as soil in which people can thrive. Humaculture then forms the basis for a systematic approach to making all decisions of a business or organization. And it's always in the context of the 7 dimensions of humaculture. Our webinar today is focused on compliance and specifically a strategic response to compliance. And if you think about it, compliance would fall into the environment, one of the 7 dimensions. So we always allow the humaculture philosophy to guide all of our work, even when we engage selectively or very narrowly on certain aspects of the organization. In this case today, compliance. The environment is one of the 7 dimensions of humaculture, and it includes the compliance with laws and regulations and the things that go along with that, either the current ones or the ones that will be coming out later. We will always help or strive to help organizations understand how any aspect of our work can be understood in the broader context of the 7 dimensions of humaculture and how each aspect then impacts the other. Steve?
Our goal today is to help you understand why it is important to go beyond basic compliance. We'll offer some suggestions on strategies that respond to the No Surprises Act compliance as a means to create a competitive advantage. We've developed a compliance toolkit, but we don't think mere compliance is enough. Our humaculturists can help you comply, or we can help you comply and offer approaches that may enhance your participants' experience with health coverage without increasing participant or plan costs. By the end of this session, you'll know why the No Surprises Act doesn't eliminate all surprises and why it will likely add to health cost inflation. We'll confirm that a compliance-only path may create an undesirable rocky or weedy soil, and that the better option is to comply and develop a strategic response, one that ensures you avoid what can be avoided yet allows the plan and participants to prepare for and finance that which can't and or which shouldn't be avoided. Finally, we suggest any apparent negatives be represented or communicated as part of or because of required compliance. We can help you create anticipatory communications to reach participants as consumers before they become patients. Jack will take it from here to illustrate why you should consider a strategic response.
Thanks, Steve. So the next slide is one that identifies that the No Surprises Act doesn't eliminate all surprises. It's important to point out that where we expect to see the majority of the compliance activity is when a out-of-network provider provides a service in-network. Interestingly, there was a 2020 Kaiser study which reported that 39% of adults said that they had received an unexpected medical bill in the past 12 months. Only 1 in 10 said the bill was from an out-of-network provider. Whoa, stop right there. If only 10% of non-elderly adults received an unexpected bill from an out-of-network provider, that means that at least 75% or more of the unexpected bills were just regular point of purchase cost sharing, deductibles, co-payments, co-insurance. So in those situations, the majority of situations, the unexpected bills may not qualify as surprises under the No Surprises Act. Therefore, many, perhaps most services provided by out-of-network providers won't be addressed by the No Surprises Act. Steve?
Chances are you and your service providers are currently working on achieving compliance with the No Surprises Act. Many of its provisions apply to plan years beginning on or after January 1st, 2022. However, we believe that basic compliance will add to the cost of coverage through increased employer-paid medical expenses, by out-of-network services being paid now on an in-network basis, medical cost inflation by prompting both in-network and out-of-network providers to increase charges and provide more services, and in turn, increase employee-paid expenses through cost shifting. More importantly, we believe that a strategic response offers value to both the plan sponsor and the participants. In a few minutes, Jack will walk us through an example that demonstrates many of these points. Again, this and our subsequent sessions provide examples. The best approach for your organization will depend upon the type of soil you are trying to develop.
So compliance is complex stuff. A plan sponsor that doesn't comply could be subject to significant penalties. For example, the health reform penalty of up to $100 per participant per day. For you math whizzes, that's $36,500 per participant per year. Now, there's going to be some limits and exceptions and everything else. The No Surprises Act does add to administration and administrative costs. It adds new arbitration provisions and costs. And with the increased requirements also comes an increased risk of litigation with providers and plan participants. So anything you can do to minimize the need to comply will benefit both the plan sponsor and plan participants. Next. I'll use this example claim of surgery at an in-network facility to try to demonstrate the impact. This illustration is 2021 prior to the No Surprises Act, but it could have been 2022 if the out-of-network provider had given proper notice and obtained consent. So the benefit structure in the upper right-hand corner there is a traditional PPO with both in-network deductibles and coinsurance and out-of-network deductibles and coinsurance. This person has elected family coverage. He has this one surgical claim in 2021. The anesthesiologist is out-of-network performing services at an in-network facility. I'm going to assume initially that all expenses are covered charges. The participant ends up paying $15,300 out of pocket. Plan pays $31,200. The surprise in 2021 was when the participant got the bill from the anesthesiologist, and after the claim had been processed as an out-of-network charge at a hospital, even though he went to a hospital that was in network. Next. Here's the same bill applying the No Surprises Act, where there was no notice or consent. Here, the anesthesiologist charge would now be moved in network, and we assume reduced to the median network reimbursement or the qualified payment amount. Participant paid point of purchase expenses reduced significantly, $5,300 or 35%, because we shifted the expense to an in-network charge where the in-network out-of-pocket expense maximum is satisfied. The plan costs increased $2,300 or 7%. And of course, the example assumes everything is static, that there was no response by the providers, that there's no inflation. Now that's not realistic, especially not realistic over time. Next. So yes, the No Surprises Act will add to healthcare cost inflation. As this graph indicates, we've seen the inexorable historic inflation in healthcare despite laws designed to bend the cost curve. If we extended the graph going forward, the slope of that line will become even steeper because the No Surprises Act costs will add another layer of expense. Costs will increase as more charges will be treated as in-network to cover the cost of compliance and administration. And think of it this way, when network providers who charge below median levels see what others charge, why they might just, increase their prices to at least the median so that they received as much as an out-of-network provider who offers the same services. Again, look at the last 10 years of healthcare cost inflation. Look at the slope there of the lines, all post-health reform. Now that result occurred in part because many, perhaps most employers decided on a compliance-only response. And finally, since most employers share the cost of coverage over time, simple compliance will ultimately increase both employer and employee contributions. Next. If you take nothing else away from this session, remember to apply Yogi Berra's famous words. When you come to a fork in the road, take it. It's just one of many yogiisms. I'm pretty fond of his comments. So if you only take the path to compliance, you may be adding rocks or weeds to your soil. And that will not be particularly helpful, nor will it improve workers' perception of your health plan. Keep in mind that compliance is a never-ending challenge. It isn't just the regulations, it also includes sub-regulatory guidance. For example, on October the 4th last year, 2021, just 3 months ago, we got our 50th health reform frequently asked question, almost 12 years after the health reform law, PPACA, became law. So remember to also take the strategic path, create more fertile soil where you can avoid at least some aspects of compliance, cultivate a better organization with less expensive, more beneficial health coverage. Next. One strategic response you may want to consider is adoption of reference-based pricing. Plans with RBP but no network providers are generally not subject to the No Surprises Act. In this example, I made 2 changes. I eliminated the in-network, out-of-network structure, so you can see the coverage in the upper right. And, excuse me, the only change I made to covered expenses was to reduce the hospital covered charge to 1.5 times the Medicare allowable. That is, in this situation, we would be asking the hospital to accept 50% more than they would accept for these same services if this same patient were age 65 and covered under Medicare. The result? Well, both participants and the plan experience a noteworthy reduction in spend when compared to the same expense in 2021. And importantly, by eliminating the network design, while otherwise retaining the same covered charges that would have applied in network, we avoid most of the No Surprises Act compliance requirements that would otherwise increase the cost of coverage in 2022 and in the future. So it's time perhaps for you to consider, as a means of improving the associate experience and value, reference-based pricing while reducing the spend. Next. The number one impediment to adopting reference-based pricing is balance billing. We always recommend you concurrently adopt participant protections against balance billing. Integrating those protections is an essential component to achieving the promised savings. Some firms that provide representation report as much as 95 or more % success rates at securing the RBP promised savings for the employer and for the participant. I'm very active in this space. Steve?
So the Humaculture philosophy and approach can guide you as you seek strategic ways to adjust plan design so that the participants are prepared for out-of-pocket costs, expected or unexpected. It will also guide the development of communications that support the strategies you adopt, as well as enhance their success. Remember, our focus is to feed the soil. Effective behaviorally designed communications will lead to employees, customers, shareholders, and others to make the best use of the fertile soil of your organization. Let's consider some aspects of effective behaviorally designed communications. Here are a few examples of heuristics from our library that can apply to your communications. For those that aren't aware, heuristics is another term for mental shortcuts that people use in making decisions or understanding situations that they encounter. We can use this compliance opportunity to blame any cost shift related to the strategic design decisions that you make on your need to comply with these new rules. You can set or reset expectations to confirm that participants control their own preparation and spending. Communication should engage participants to be good consumers. Participants respond to familiar or recent adverse events. As such, to communicate ideas, find examples where someone had to satisfy their out-of-pocket expense maximum or experiences a balanced bill to highlight the potential impact. People respond to situations where they believe it could actually happen to them. Leverage the possibility bias by using illustrations of actual balance bill expenses or out-of-network costs to show what may be possible so participants choose wisely. It's time to educate, time to prepare, time to encourage employees to become good consumers before they become patients. Wes?
Sure, thanks, Steve. Well, I hope today that we've been able to help you see the reasons that the No Surprises Act really won't eliminate all surprises. It will also likely increase costs for both plan participants and plan sponsors. It's really going to also add to the administrative burden of employers. So a strategic response is really important, and a strategic response should help you minimize the work effort to comply, to meet all the compliance requirements, both now and even in the long term. And it should also result in better responses from your employees and your just with your health plan in general. Congress is going to want to take credit for shifting the expenses to the plan, improving the benefits of plans by applying in-network cost sharing for those few items that are currently out of network. But the last 50 years has shown us, as Jack's graph so well demonstrated earlier, that the efforts of government to help along the way, to give their help, has really not helped at all. In fact, the inflation is still continuing on. Participants tend to want to over-insure. They're really concerned about their out-of-pocket expenses, and even minor changes in out-of-pocket costs are problematic. So this may be a good opportunity to think more strategically and find ways to actually improve your organization and the lives of the people who interact with it. Steve?
So we're going to move into the questions and answers, but before we do that, I wanted to note that we have developed resources to support not only your basic compliance needs, but also developed a strategic approach to respond to the new requirements. When you receive this this deck, you will see some links to our website for some of the resources we've made available. And I want to remind you of our subsequent sessions that will focus on additional strategies that you can take, examples of strategy that you can take to not only comply, but to make it this a strategic, leverage these as strategic opportunities to better manage your benefit programs while differentiating your value proposition for the talent that will advance your company's business objectives, while also financially differentiating you from your competition. With that, let's move into our questions. And as I said at the beginning, we'll follow up with a written Q&A to be distributed to all participants in today's session. Our first question: is it realistic that reference-based pricing can pay 40% lower rates than networks' negotiated rates, as you had in your illustration? Jack, do you want to address that?
Sure. The answer is yes. There's a number of studies that confirm significant variability of hospital and provider charges, quite a range. The goal of reference-based pricing is to set the benefit or reimbursement rates, the maximum allowable charge, at a reasonable level, not the lowest nor the highest of provider charges for the same service.
Thanks, Jack. The next question is: does reference-based pricing absolve the plan sponsor from its requirements to provide an advanced EOB?
No, it doesn't. But please attend our next session in February, where we'll show how the advanced EOB, while maybe a compliance challenge, will perhaps open the door for consumerism when participants are spending money that they themselves have saved. When they see that, when they have to spend their own money, as we will show in the next session, they might do some shopping as a consumer before they become a patient. I mean, why spend more of your own money than you have to?
Thanks. I know you don't want to, here's the next one. I know you don't want to get into compliance, but there's some confusion out there. For example, when determining the qualified payment amount, do you use the median coverage charge for all network providers or the median coverage charge for the out-of-network provider?
Well, generally the median coverage charge for all network providers for the same service in the same geographic location. But it ain't that simple. You start with the median contracted rate for the same or similar item or service under the plan or coverage as of January 31st, 2019. Then you've got to increase it by the percentage provided by the IRS based on the Consumer Price Index U, which for 2022 expenses is 1.064852 whatever. After you apply that percentage increase, group health plans and insurers can round any QPA calculation to the nearest dollar. Now that factor, that 1.06 whatever factor, was announced earlier this month as part of RevProc 2022-11.
And yes, that they really do have about 10 significant digits to that factor. I got time for one more question. Doesn't the No Surprises Act apply to network plans where an out-of-network provider's coverage charge for services performed at an in-network facility are determined by reference-based pricing?
Yeah, it does. The reference-based pricing that you might already have in your plan won't be determinative of what's called the qualified payment amount. You still have to go through the calculation where the non-network provider charges will be subject to the No Surprises Act and the QPA.
Thank you everyone for attending. As mentioned, we will send out a link to this, to rewatch this presentation. I think there might have been an audio glitch at the beginning of this, so you'll hopefully be able to listen to the start again. And we'll also share the rest of the questions and answers as well. Thank you, and we appreciate your participation.